Health officials coordinating efforts to check the spread of the Ebola virus in Nigeria say they are now monitoring 70 persons who came in contact with a Liberian man who died of the virus last week in Lagos for any possible symptoms of the virus. Given update on the team's effort at checking the virus, Lagos State Commissioner for Health, Jide Idris, says while two of those being monitored have come down with fever, none has tested positive for the virus so far.
An emergency operations center has been activated in Lagos with the National Center for Disease Control of the Federal Ministry of Health in close collaboration with the Lagos State Ministry of Health and other partners such as the WHO, the CDC, and UNICEF. The key activities of this center include, as an update, the establishment of an isolation unit in Lagos. This unit is a standalone facility that has a one-way flow until the health worker is decontaminated. It has dedicated water, sewage, and power supply. The healthcare workers associated with Lagos, this facility, have received training on the provision of care to Ebola virus disease patients. Special emphasis of the training has also included the protection of patients and those who work with them through good clinical practice and infection prevention and control measures in the isolation unit. This type of training is planned to be replicated in other states as part of our preparedness plan. The contact tracing team is currently following 70 contacts of this case and linking them to clinical support when needed. The two suspect cases who had fever that were reported 2 days ago are under observation and so far have tested negative for this virus. Suspect cases will continue to be monitored until the end of the incubation period for 21 days from their exposure to the traveler who had the disease. The federal government has stepped up measures to increase incoming passengers to Nigeria to identify any traveler with symptoms through the airport, the seaports, and the border and the land and border crossings. Recently, a diseased body was brought into Nigeria from Liberia. We are currently investigating if this person died of Ebola. As more information is received, we will identify and monitor contacts and work with local health personnel. As of now, I think the team is being dispatched to Anambra State.